Hey everybody, we're Group 10.
And our topic is effects of understaffing in the hospital setting.
South Carolina is facing an ongoing shortage of nurses and hospitals across the state.
It's a problem with real impact because it might affect the quality of care we get. The University of South Carolina, other nursing schools are trying to solve the issue.
And 7 News reporter Robert Kittle shows us how.
I'm Caroline. Nice to meet you. Caroline Flynn is a junior at USC's College of Nursing and is at a job fair to talk to people from hospitals across South Carolina, Georgia, and North Carolina about an internship or possible job in the future.
I really like the patient-centered care. I love that, nurses really take care of the patient and get to spend a lot of time with them and really take care of their needs. And so that's what really drew me to nursing.
She also likes the fact that she'll be in demand because South Carolina has a shortage of about 2,000 nurses statewide. That can affect the quality of care you get.
We're going to have deaths. We're going to have unintentional injuries happen. And right now across the state, there's a critical shortage of nurses at the bedside.
Rhonda Hughes is the director of USC's Center for Nursing Leadership. Hughes says if you get above a 5% vacancy rate for nurses, the risk to patients doubles or even triples. And some places in South Carolina have a 20% vacancy rate. She says one reason for the shortage is that the work nurses do is physically and emotionally exhausting.
Well, they'll go in, but maybe do it for a couple of years and then go find a 9-to-5 job.
There's also a shortage of teachers. A nurse can make more money nursing than teaching, and a lot of current faculty are getting close to retirement age. So nurse leaders and nursing schools across the state will ask state lawmakers for at least $2 million in the budget to raise nursing faculty salaries. And hospitals will keep coming to job fairs trying to get the nurses they need.
I think we have what we need, but it's just the fear of what if and what happens next week or next year. So we're trying to prepare for the future.
Hello, my name is Fletcher, and today I will be talking to you about the effects that understaffing has on a facility. In recent years, everyone has been hearing about the economic depression and how it's been seen in many of the United States small businesses along with large businesses such as a hospital. In efforts to increase profits, hospitals cut back on nurses, and what they think is that when they cut back on the amount of nurses that they have on a floor, this will actually decrease the money they spend. Well, RN nurses make up the largest profession, the largest group of healthcare professionals in the United States. With that being said, RN's wages also make up a large percent of hospital costs. Hospitals have to have enough money in order to pay their nurses. And they believe that they can save money by actually hiring and staffing less RNs. However, adequate nurse staffing leads to better outcomes for both patient and nurses, as many studies show that decreasing RN staff actually causes more problems in the hospital. Sufficient staffing of nurses lowers adverse hospital events. With adequate staff, patients are less likely to be involved in adverse events such as infections and additional illnesses. As we'll explore on the next slide, the more adverse events that occur due to understaffing, the more money the hospital has to pay. So, increase in nurse workload by one patient increases chance of mortality, which reflects on the hospital. So when a nurse receives another patient on top of her already busy load, that one patient could cause the nurse to make a critical mistake, and that mistake will fall back on the hospital. Hospitals with higher staffing lower odds of having readmission, which means less paying out of the pocket, because when a hospital treats a patient, that patient comes back and is readmitted to the hospital, insurance companies are not likely to pay for the stay, and therefore the hospital is required to pay for that themselves, and that will in turn lower the profit margin, and they will think that they need to use less staff on the floor when it may have been that low amount of staff that they had working that day that caused the problem. So So higher nurse to patient ratios can lead to hospitals paying for more occupational injuries due to unsafe environments. And that could be, for example, a nurse that is scheduled to work. She has a very large patient that is maybe 200-300 pounds heavier than she is. Well, on a normal day, that nurse may be able to call on a coworker to come over and help her to move the patient to the bedside commode, maybe walk them down the hallway. Well, they are understaffed and she has to try to attempt to do that on her own. It's now a problem for this facility because they now have to pay for the nurse to get treatment along with the patient to get treatment. And that, once again, lowers the amount of profit that hospital is bringing in because they thought they could use less nurses on the floor. Thank you.
Hey, I'm Chelsie Brim, and I'm going to be talking to you about how management affects on understaffing. The priority role of a nurse manager is to ensure a safe work environment and sustain quality of healthcare and patient safety. A nurse manager finds it increasingly difficult to cover staffing needs on her unit. That's one of the problems. Life gets in the way, people calling sick, mistakes in the schedule can happen, especially I work at South Georgia, and my nurse manager is in charge of 3 floors, so that alone can be stressful, especially when you're trying to schedule so many people and mistakes are going to be made. They're human. They have to adjust the schedule based on patient census, because if you have 8 nurses coming in and you have 10 people on the floor, nurse managers also have to adjust the schedule to the patient census. So X amount of patients means X amount of nurses. 70% of nurse managers become overly concerned about quality of care for patients if they're understaffed. Patient satisfaction decreases because they feel like the nurse is doing what he or she has to do and they leave without explaining anything. So for example, if a nurse has 7 patients on a med-surg floor and she has an order to place a Foley, and she rushes the procedure, breaks their field, she's already increasing the risk of a patient receiving a healthcare associated infection. And nurse managers are trying to find ways to increase employee morale due to nursing fatigue. So a way managers can improve nurse fatigue is giving incentives or changing small things around the unit that people have concerns about. When constantly being asked to work during days off, they'll feel unappreciated. Substandard nurse managers will not stand up for their employees despite witnessing the effects it can have on the nurses. Over-controlling nurses, autocratic leaders, are likely to discourage the work environment, which makes employees feel like they don't have an opinion or they can express their ideas or come to you if they have a conflict. Not having proper communication between the manager and employee can have an impact on the quality of care a patient receives. Transformational theory of leadership can help decrease negativity amongst nurses and remind them of why they're there despite the work conditions. This type of leader, I feel like, can influence and resolve the negativity just by making the employee realize why they're there. They're there to help the patient when they're most vulnerable. A possible way to resolve issues is to have a democratic leader willing to listen, advocate, and support their nurses. Me personally, I would want to have a democratic leader. I would want to feel comfortable enough to, A possible way to resolve issues is to have a democratic leader willing to listen, advocate, and support their nurses. Me personally, I would want to be under this type of leader. I would enjoy going to work knowing if I have a problem, I'm going to be heard.
Hi, I'm Desiree, and today I'm going to be covering the effects of understaffing on nurses. As nurses, part of our care is based on the 6 ethical principles. I want to highlight one in particular as it applies to our topic. Non-malfeasance is defined as an ethical and legal duty to avoid harming others. Being on a floor and having a high patient-to-nurse ratio can cause us to not be able to carry this out. This in turn can cause us to have ethical dilemmas. One example of an ethical dilemma would be possibly not having the time to give proper education on medication or discharge. More time being spent some rooms versus others as well. This constant running around and nonstop between high volume number of patients can cause serious burnout and fatigue. The 12-hour shifts could turn into 14 just to get caught up on the charting we had missed out on all day, which in turn could definitely cause problems you will most likely forget and can cause a mistake in the charting or to not chart at all. This gets old. Nurses start looking for other jobs in private offices due to good staffing and better hours, and you just start to lose all your continuity due to a high turnover rate. The more experienced nurses' attitudes over them having to pick up the slack and having to cover more shifts are causing the younger nurses to just start seeing things in a different light. There's a high volume of younger nurses that get a bad taste and just decide to change career fields. However, understaffing can be categorized into two different groups, acute and chronic. Acute understaffing is more along the lines of temporary staffing issues, such as maternity leave or somebody just calling in sick. Flu season's right around the corner. And chronic issues is basically the hospital trying to cut costs by ensuring the max level of patients can be assigned to the nurse. So this can cause a problem because, for example, in my clinical experience I just had, the hospital was pretty much just all full, and my nurse got assigned 7 patients. Now, having 6 patients gets a little hectic. 7 patients, we had 5 discharges and 3 new admissions, and we didn't sit down, and we were there for almost 13 hours. And I wanted to just stay out of her way because I seen just the entire floor was just swamped, and I witnessed firsthand the effects on how this causes such huge problems on the nurses, and how all of them just slumping their shoulders and sitting there, and it's starting to, affect patient care.
Hi, I'm Allison Black, and today I'll be speaking with you on the effects of understaffing nurses on patients. Patients are the #1 priority, not only in nursing, but the healthcare field in general. According to Crystal Martin, inadequate nursing staff affects patients, their loved ones, future and current nurses, as well as the facility that they are employed in. As mentioned previously by my group members, inadequate nursing can be caused by hospital budget cuts, nurses calling out sick, scheduling mishaps, and an increased patient census. Studies have shown that every additional patient added on to a nurse's normal workload increases his or her patient's likelihood of dying within 30 days after being admitted to the facility by 7%. When the number of nurses working is lowered, the patients suffer major consequences. These can include, but are not limited to, decreased care, inadequate one-on-one time with the nurse, improper medication administration, and an increased risk of an adverse event occurring. Adverse events that can occur due to the nurse's understaffing can include pressure ulcers, hospital-acquired urinary tract infections, deep vein thrombosis, pneumonia, falls, and many other events as well. As nurses, it's our responsibility to ensure that our patients have the best care. When understaffing occurs, it's impossible to care for the patients in the way that we want to. Some patients will go through this experience and not have any problems, but the patients who need extra care can suffer majorly. Patients are already nervous about being in the hospital and having to stay. We don't need to add any more stress by not explaining procedures they will have, not explaining medications, and not being able to talk to them therapeutically. We need to ensure that we have enough time to explain these procedures, to explain these medications. It may be a medication this patient has never taken before. It could be a new ordered medication. And we need to ensure that we have enough time as nurses to adequately explain what this patient is going to experience. And our second question of the presentation will be, what are major causes of nurse understaffing? We'll give you a second to think about it, but the answer that we came up with is the major causes of nurse understaffing includes hospital budget cuts, nurses calling in sick, scheduling mistakes,